How do liquid biopsies monitor bone cancer chemotherapy? Imagine a simple blood test giving doctors a detailed look at how bone cancer is responding to treatment. That's what liquid biopsies do. They are a minimally invasive way to track how tumors change over time during chemotherapy. Instead of needing to perform painful tissue biopsies repeatedly, doctors can analyze components floating in the blood. This approach is especially helpful in bone cancer, where traditional biopsies can be difficult and risky due to the tumor's location near vital structures like the spinal cord or major blood vessels. Liquid biopsies work by detecting tumor-derived materials in the bloodstream. One key component is circulating tumor DNA, which are tiny fragments of DNA shed by cancer cells. When chemotherapy is effective, levels of circulating tumor DNA tend to decrease, indicating that the treatment is killing cancer cells. If levels rise or new mutations appear, it might suggest that the cancer is developing resistance or progressing despite treatment. This real-time feedback helps doctors decide whether to continue, adjust, or change the chemotherapy protocol. Another important element is circulating tumor cells. These are whole cancer cells that have broken away from the primary tumor and entered the blood. Counting and analyzing these cells can give insight into the tumor's size and its ability to spread. Changes in the number of circulating tumor cells during treatment can signal how well the therapy is working or if the cancer is becoming more aggressive. Extracellular vesicles are tiny particles released by tumor cells that carry proteins, RNA, and DNA. Monitoring these vesicles can reveal how the tumor's molecular profile is changing in response to chemotherapy. This information can help determine if the cancer is adapting or if certain pathways are becoming more active, which might influence future treatment choices. Because liquid biopsies can be performed repeatedly, they allow for dynamic monitoring of the tumor's evolution. This means doctors can detect minimal residual disease or early signs of relapse before they become visible on imaging scans. Early detection of resistance or recurrence can lead to quicker adjustments in therapy, potentially improving outcomes. The information gathered from liquid biopsies also helps personalize treatment. If specific mutations linked to drug resistance are identified, oncologists can tailor chemotherapy protocols to target those mutations more effectively. This personalized approach aims to improve the chances of success and reduce unnecessary side effects. In the case of bone cancer, such as osteosarcoma or Ewing sarcoma, liquid biopsies are especially promising because they offer a less painful, safer way to monitor disease progression. They provide a window into the tumor's biology without the risks associated with repeated invasive procedures. While this technology is still being refined and integrated into clinical practice, ongoing research supports its potential to improve how we diagnose, monitor, and treat bone cancers. Challenges remain, like standardizing methods and reducing costs, but the future looks bright for liquid biopsies as a tool to guide chemotherapy. It's important to remember that liquid biopsies should complement traditional imaging and clinical assessments, not replace them. Every patient's situation is unique, and treatment decisions should always be made in consultation with healthcare professionals. This approach helps ensure that each person receives the most accurate, personalized care based on the best available evidence.